Okay, so now we're going to talk about magnetic resonance imaging, or MRI, which is a newer imaging modality. You can see that it first was discovered or developed for clinical use back in the 1980s, and it has since taken off quite dramatically since then. So in uh, MRI, effectively what happens is there's a giant magnet that produces a magnetic field, and then there's a RF generator, or a radio frequency pulse generator, that's going to send out these RF pulses to through the magnetic field, that is then going to cause perturbations in the alignment of the hydrogen atoms that are aligned based on the fact that they are in this strong external magnetic field. And then the MRI has a series of detectors that are going to measure the relaxation dynamics based on the RF signals emitted by these protons as they relax from a given RF signal. So I should note that there are different strengths of MRI magnets. Most clinical scanners are either 1.5 or 3 Tesla, or 3T units, as we refer to them. So Tesla is the unit of measure for magnetism. And so again, most clinical scanners are 1.5 or 3 Tesla units. Most of them have been upgraded to 3 Tesla units, but there are still a fair number of 1.5 T MRI scanners in clinical use today. In 2017, the first 7 Tesla MRI went online at Mayo Clinic in Rochester. And then in 2018, the first 10.5 T MRI scanner, which is just for research use right now, was acquired. And so the first images on humans were acquired at the University of Minnesota with that unit in 2018. Of note, that scanner weighs 100, actually just the magnet of that scanner weighs 110 tons, and it has to be cooled to negative 455 degrees Fahrenheit. So you can see where some of the cost comes into play with these scanners. That the magnets are very large, very finicky, very difficult to work with, and so as a result, MRI scanning is rather expensive. So I put some links in here that you're welcome to check out. There's one here for that describes the University of Minnesota unit. You can see it being installed, and then we're going to also check out this DICOM viewer here momentarily. So what I want to do with this is just show you, this is another head MRI scan. So just kind of look for some of the differences between this versus the CT, the head CT that we looked at previously. So again, you can see that this is effectively a DICOM viewer, and so you're able to move through the slices of the head at several millimeter increments. And as you go, you're able to appreciate various structures. So just as an example, you can see coming from the eyes right here, you can see the optic nerves on either side. You can see them also coursing back here towards the optic chiasm. But one thing that you'll notice is, for example, when you look at like the white matter through here, you can see these darker areas. These represent deep gray matter nuclei, so these collections of cell bodies deep in the brain, which the importance isn't what the structures are, but instead just the fact that you get this really nice resolution with MRI that you don't get with CT. So on CT, this would all just kind of look like a hazy gray color, but here you actually get this really nice crisp resolution. So MRI scanning is extraordinarily useful for central nervous system disorders, as well as peripheral nervous system injury and disorders. It's also very good for imaging ligaments and tendons and other soft tissues around the body. So again, you can see here's a coronal scan where once again you get just this exceptional resolution on MRI, with you can see various soft tissues, not only in the brain but also in the head and neck, can be very nicely appreciated with MRI. So again, just kind of keep that in mind, that you want to be thinking about what the strengths are of these different modalities. So going back to our PowerPoint here, a couple things I want to talk about is, first off, before we jump into the different sequences that are used, I wanted to talk about some of the advantages of MRI. So again, I already noticed or pointed out to you that it provides superior soft tissue contrast due to its ability to penetrate bony and air-filled structures with negligible attenuation, which again is very different than X-ray or CT, where as soon as that beam passes through a structure, it's going to become attenuated to some degree. And so when it goes through bone, that's obviously going to attenuate it significantly and affect the signal. But that's just not the case for MRI. It passes right through the body, no problem, and so that's what gives you that really nice soft tissue resolution. The other major advantage of MRI is the fact that it does not use ionizing radiation. So it is a relatively benign process. So it does not cause significant, really any tissue damage that we're aware of, unless there's some sort of implant in the person. Then it becomes dangerous at that point. So in terms of downsides of MRI, it's very costly, as I mentioned previously. The scanning speed is quite slow relative to CT. So I said CT, you scan an entire body in under a minute. MRI, it takes a much longer period of time to acquire the images. The other thing, the reason that's problematic is that means that movement is going to cause artifact. So it's going to make it harder to see the structures you're trying to appreciate if the patient is moving. So as a result, with children, for example, they oftentimes have to be anesthetized for MRI. Sometimes they'll be sedated for CT, but they almost certainly have to have general anesthesia when they are imaged with an MRI. Same thing with adults. Sometimes you need them to hold their breath, and so like when you're doing a chest MRI, if they can't hold their breath long enough, then that's obviously going to interfere with the imaging acquisition. Now, we are starting to use MRI to image the heart, which you might imagine could be very difficult considering the fact that it's constantly moving. But the technology is advancing so that is now a capability that we have. So again, those are just some of the downsides of MRI. The other thing is there's extreme danger associated with metal objects coming into close proximity to the magnet. So anything that's metal is going to be drawn into that magnet with significant force. So you can pull an entire X-ray unit into it, wheelchairs, anything that's metal is going to get pulled into that. So you have to use extreme care when you're around an MRI device, and the magnet is never off; it's always on. So that is something that people always have to keep in mind when they're around an MRI. It also means that for some individuals, it's a contraindication. So if you've had like a hip replacement, like I showed in the last video, you can't obviously then have an MRI because that implant, if it's paramagnetic, is going to be attracted to the MR magnet. And same thing with stents and other implants in the body. If you have a bullet in your body, any kind of piece of metal, it is either A, going to potentially heat up, or B, it's going to be tugged at by that magnet and can even be pulled out of the body if the right situation, if it's put into the right situation. So again, can be very dangerous. There's a lot of safety protocols around how to appropriately use and be within close proximity to these MRI units. So there's over 100 different types of MRI sequences. And so when I talk about sequences, this just basically means the way that the computer algorithm processes the data from the MR instrument. So for the most part, the computer becomes a vital asset to the way that we process, or the fact that in order for MRIs to be produced, you need a very sophisticated MRI algorithm and software to do that. So we're only going to discuss a few of these sequences in this course. The two major ones that we're going to talk about that are most widely used in clinical practice are T1 and T2 weighted images. And so this image here on the right is an example of a T1 weighted image. And so in these T1 images, fat is hyper intense or bright. So again, you can see that like the orbit, for example, which is loaded with fat, that you can see how that is bright. So fat is bright in a T1 image. So we say it's hyper intense, whereas water is hypo intense. So it's black or dark on T1 weighted images. So like CSF, edema, and most lesions are going to appear dark. So as a result, T1 is really not very good for imaging pathology, because pathology is almost always going to have some sort of fluid issue associated with it, edema, bleeding, etc. And so again, you won't be, not to say that you can't see them on T1, but they're just not going to be as easily seen with some than they are with some of the other sequences that are used. And so you'll notice that because the fat is bright or hyper intense, you can see here that obviously the scalp has this kind of whitish very bright white appearance to it. But the bone, which is underlying it, you'll notice it is very dark. It's black. And so again, this is going to be one of those things that you have to keep in mind when you're looking at a T1 image. So you might be thinking, if it's not very good for imaging pathology, what is it good for? Well, it's actually very good for imaging anatomy. So anatomical structures are very nicely visualized with T1 weighted MRI images. So we'll be using this quite a bit in this course, especially when we're looking at the CNS. So here, looking at another T1 weighted image, just to kind of re-emphasize this. So you can see, obviously, air is dark. You can see, like in the frontal sinuses here, obviously hypo intense, and so therefore dark. Water, also dark. So these are the lateral ventricles right here, which you can see are obviously filled with CSF, and they appear dark. So the majority of that is water. So that makes a lot of sense. And then remember that fat is going to be bright, so you can appreciate that around the scalp here, the subcutaneous tissue underneath the dermis there. Here's another T2 weighted image. So again, in this case, water is hyper intense. So this is the opposite of what you see with T1 weighted images. So T1, the CSF is dark, water is dark, and T2, water is bright. So you can see obviously all the CSF surrounding part of the brainstem right here, and this is the cerebellum back here. So you can just see how all the fluid that the brain is floating in, it appears bright white. You'll notice that the fat is also kind of this lightish color still, so that's similar from what you see with T1. Dense bone, so you can see all this dense bone that's forming the cranium, that's all dark as well. So that calcium, any kind of calcium deposits are going to appear dark, and then flowing fluid is also going to appear dark on a T2 weighted image. But blood, so like extravasated blood, edema, most lesions are going to appear bright white on a T2 weighted image. So again, T2 is exceptionally good clinically for diagnosing various lesions or pathology. So here you can see, once again, the water in the ventricles is bright, and then pretty much everything else that you see here is dark. Fat is again kind of a lightish color, but not quite as bright as it is on T1. All right, so another common MRI sequence is called fluid attenuated inversion recovery, or FLAIR. So most people just refer to this as a FLAIR sequence. So this is going to be effectively pretty much the same as the T2 weighted image or sequence, except that free CSF is suppressed or hypo intense. So you'll notice that the CSF in the ventricles appears dark. So superficially, this looks a lot like what you see with a T1 weighted image. But one of the features of FLAIR images that will distinguish them from T1 images are the hyperintense or whitish outline that you see surrounding the ventricles. So you can kind of see how there's like this white halo surrounding the ventricles. So that's a good way, in the brain at least, to be able to differentiate a FLAIR sequence from a T1 weighted image. Now, CNS pathology, or FLAIR, is very good at visualizing CNS pathology because lesions are going to appear hyperintense or bright white. So that's one of the reasons that we like FLAIR, is it's even better than T2 in terms of being able to localize lesions in the CNS, at least in some situations. Diffusion weighted imaging, or DWI, is another sequence commonly used for visualizing pathology in the CNS, since it's sensitive to the passive diffusion of water, and areas of restricted diffusion, like areas that have recently experienced ischemia, are going to appear bright. So once again, very good for looking for strokes, especially ischemic strokes. DWI is phenomenal for that. But one of the problems with it is it does have very low resolution. So you can kind of see the resolution is quite poor on this image. All right, so now we're just going to look through a few other images, but before we do that, I just wanted to point out that just like with CT, contrast is frequently used with MRI, and the most common contrast agent is known as gadolinium. Okay, so gadolinium contrast is going to appear hyper intense or bright on MRI. Okay, and so although gadolinium, like iodine and some of these other, and barium, they can cause adverse reactions, it's very, very rare. Gadolinium is normally very well tolerated by the vast majority of people. So again, it can cause problems, but it's relatively rare. So here we have we're looking at a T1 weighted image in this case. So again, you can see the ventricle back here, and you'll notice that the CSF is dark, and so that tells you that that is obviously going to be a T1 image. Now remember that because this is just like CT, this is going to be posterior, and this is going to be anterior. This is going to be the patient's right. This is going to be the patient's left. Okay, and so you'll notice when you look at this image, you can kind of see that there's like this darker spot over here on the left that you don't see over here on the right. And so we're going to look at this on a couple other sequences and see what we think. So first off, this is with contrast. So this is where gadolinium was administered. And now you can kind of see this halo or surrounding this dark region right here. So that should automatically kind of bring your attention to that potentially being an important lesion there. And then here we have on T2, notice that now you have this enhancing lesion right here, this bright hyperintensity on this T2 weighted image. So once again, you can see the bright CSF and the lateral ventricle, the posterior horn right there. You can also see it up here on the anterior aspects of the lateral ventricle. But notice there's all this fluid that's been building up, kind of this edematous environment around this tumor right here. And so that's you can see how much easier it is to appreciate this lesion on T2 versus T1. So T1 with contrast is a little bit better, but man, T2, you can't miss it, right? So you can see how pathology is very easily seen. And so this is effectively what you were looking at right there, a glioblastoma or a GBM, one of the most deadly tumors clinically today. So now we're going to look at a couple other head CT images or head images. In this case, we have a CT scan, so you can see the bright white bone. So that should tell you right away that you're probably looking at a CT scan. Here we have a T1 weighted image. So again, the CSF is dark. You can see the fat is bright within the orbits. And then when you look at this image, you're just kind of looking for patterns. And so here, like normal brain tissue, you're going to have kind of the darker gray matter on the outside, white matter on further deeper on the inside. And so over here, you see that there's sort of this darker kind of region that you don't see on the contralateral side. So, you might be kind of wondering, oh, that looks a little bit odd, but is it important? And so it turns out that it is important. And you can appreciate that here on T2 because once again, you can see that this is a tumor that's located right there in the right temporal lobe of this individual. Okay, and so that is going to be the conclusion of this presentation. So I want you to take just a moment and look at this image and try to determine what imaging modality was used to obtain this image. I'll give you just a second to think about it. And so here, what you're going to be looking at is again, how is it presented? And so hopefully it's obvious by looking at this that this is an X-ray. You can see how most of these structures are overlapping each other. And you can see obviously the bright white representing the primarily the bony structures. You can see the trachea quite well, this dark area right here, which is going to be contain a lot more air than the surrounding areas, and so that's why that's a little bit darker there. So again, you can kind of just get a sense of how poor the resolution is on X-ray versus like on these other scans where we're looking at MRI, where you get this tremendous resolution on these structures.